So, this nursing home nightmare video is about a bad experience with a bad doctor. So, my problem is that when I first got here, they evaluate you, everything's fine. You follow your prescriptions, and as they evaluate you, they make some changes. My doctor constantly was changing my prescriptions, adding new ones, taking some away, changing the dosages. Now I'm looking at my pills every day and they're different. I don't know if the nurse is making a mistake. I don't know if these are somebody else's pills. I don't know, why am I taking different pills? So I refuse to take them 2 days in a row. The doctor comes in with my social worker, very upset that I refuse to take my pills. I says, how do I know they're not making a mistake? I says, doctor, I says, I'm not bedridden, where I can't speak up for myself. If you want to change my medication, I would like it to be discussed with me. And the doctor's getting very, very mad and very upset at this. And I said to her, would you go to take a pill from the pharmacy that you didn't know about and assume that the doctor prescribed it? She says to me, my doctor all the time sends prescriptions to the pharmacy without me knowing, and I take the pills. I says, as a doctor, you take pills that you know nothing about? And the conversation, I'm staying calm like I am talking to you guys. And the doctor's getting upset and upset. So the doctor says, fine, I'll change the prescription back. And as she's walking out the door, now I'm on opioids, because of my nerve damage and everything. As she's walking out the door, she says, let's see how you like it when I take away your pain meds. Come on. That is so uncalled for, it's not even funny. Now, let's jump ahead roughly a month. My legs swell, so I'm on water pills and stuff like that. And I get some sores. I get a blister here and there. So I had a blister on my leg, and they're doing the treatment. I asked the nurse, "Oh, what's that you're putting on there?" And it's a microbial, so no bacteria, nothing gross, so I don't get an infection. Blah blah blah. So I said I have questions for the doctor. So the doctor comes in with my social worker that day, and my social worker comes in first and says the doctor's going to be right here. I says, well, I just want to have some questions about, because I'm a diabetic, I get infections easy. Should I be on antibiotics or anything just to be precaution? She goes, that's a good question. So the doctor comes in, and my social worker says to her, well, we just have a question about the treatment that's getting done to his leg. She goes to my social worker, are you a doctor? Are you going to understand anything that I'm going to tell you? She goes, no, you're not. So this is irrelevant, and walks out the door. Horrible, horrible doctor. Absolutely horrible. All I hear from everybody is that how she's nasty and talks down to people, and really has no consideration for the patients. She shouldn't be in a facility like this. I got moved to another unit a couple of months later, and the new doctor that I got, I have great rapport with, and she communicates very well about my medications. But let's jump back to the first doctor. What I found out is, even being in this is where it's important for you guys to understand, for your family and your friends out there that are in nursing homes. You have a right by the state of New York to say it's my patient rights that I request another doctor. And by law, they have to get another doctor for you. If you're in a very small facility with one doctor, they might make the concession where you can go to your outside doctor. But in this facility, there's multiple doctors. So I said, I literally used the proper verbiage. I said, this is my patient rights. I want another doctor. I said it to my social worker. I said it to the nurse in charge. I said it to the doctor the doctor who's in charge of all the doctors, and nothing. Nobody got me another doctor. The only reason why I got the doctor that I have now is because I got transferred to another unit, and a different doctor covers this unit. So don't take the crap from nobody. If you don't like your doctor, it is your right. I don't know about any other states, so check your laws, but in New York, it is the patient's right to request a doctor. Why get stuck with a doctor that you don't have rapport with? This woman was nasty to me. I didn't like her. If I wasn't in this place, I would just choose another doctor. But since I'm here, you're going to tell me I have to use her? No, I don't. Absolutely not. So people, once again, this is a message I wish you guys can share. Let's get as many people to see this video as possible, and understand that you do have patient rights, and that should be respected by the facility you're in. But don't let doctors tell you when you should have input on your own medical treatment and medication, especially when it comes to medications. Once again, please like the video, share them, and I'll be speaking to you guys soon.